Good evening, everyone. Good evening. Is 19 hours with 1 minute of Thursday, April 23rd. We're in the National Palace and we will begin now with the daily press conference regarding the COVID pandemic, which is the disease caused by the new coronavirus SARS-CoV-2. Today we're going to have three segments. The first one is going to be presented by me, and it's going to be a brief summary of our current situation. The second one will be the daily technical report, and then third, we have a very important guest today that we are always very happy to see, who is Dr. Maria Elena Alvarez Villa. She's the director of CONACYT. She's a National Award of Sciences and Arts, and she has a very long and successful career in science. And she's also the heading figure. She's the one in charge of coordinating multiple academic group and technological initiatives who are helping us with fundamental elements regarding the control of this pandemic. And just as the President stated yesterday, and because of his petition, today we have the privilege to have Dr. Alvarez Villa, who is going to be sharing with us some important information regarding the ventilators and the adding of new ventilators to the national health system in order to help with the control of this pandemic, and she'll be going last because she's the most important participant of today's conference. Right, I'm going to stand now and I'm going to present a brief summary of where we are and where are we going now. Here we have a calendar. It's been a few weeks since we have been living under abnormal conditions, under circumstances that are not the ones that we are used to living with usually. So I want to show this calendar for you to visualize the dates. We have March of 2020, and here we can observe some important dates that can give us some perspective on the achievements we have accomplished so far. We started these conferences, on March the 6th, and on Friday 13th of March we have a special commentary on the conference about the change in the pattern of the occurrence of cases that announced to us an inflection point, a turning point, which is the moment in which we do the transition between slow propagation and fast propagation. The next day, March 14th, we participated in the National Commission that was led by Secretary Esteban Moctezuma, and we decided and agreed upon a number of measures, and this had to do with the Ministry of Education, and in collaboration with the Ministry of Education we decided that we would suspend temporarily all school activities, and this would allow us to have a decrease of 40 million people that would go out of the public space, and in this way they would contribute to the safe distance program and the mitigation measures. In other occasions, I've given another number, which is 15 million, but after talking to the Secretary of Education, Esteban Moctezuma, he showed us evidence that proves that we're talking about 40 million people who came out of the public space as a result of the suspension of the school activities. In that very meeting, we decided that the official beginning of the safe distance program would be on March 23rd. And here we have Susan safe distance at the mark of that date. We started with the suspension of school activities, and also we later followed with the suspension of all non-economic activities throughout the country. So we began with this program. Then on Tuesday, 31st, March 31st, we presented officially the measures that were relevant to phase 2, and even though we weren't quite there yet, we anticipated the phase 2, and we officially declared it 2 weeks in advance. We also formalized these measures through an agreement with the Secretary of Education, of the Ministry of Education, and also with the agreement of the President of the Republic. Now we have April. And during the first emission of the National Safe Distance Program, we first had thought that this program would end on April 19. But after revisiting the information and as the pandemic continued to develop, we decided to extend it all the way through April the 30th. And we have continued. Today is Thursday, April 23rd, and we are currently here. And as you know, a few days ago, the General Health Council decided to adopt the measures that were proposed by the Ministry of Health, and they, in consequence, extended officially the duration of the Safe Distance Program all the way to May the 30th. So this means we still have close to 6 weeks to go, but it also means that we have completed so far 6 weeks of these massive mitigation measures. Also, we've talked about how, in theory, or as a reference point, we will be coming back to school activities on June the 1st. But this will only happen if and only if you stay at home, and if we continue to implement and abide by the safe distance and the massive mitigation measures. I also want to talk about a very important reference point in the calendar, but it has to do with history. A day like today, that was also Thursday, but it was March the 23rd, 11 years ago, the influenza H1N1 influenza pandemic started in Mexico. And during that time, a series of mechanisms, from constitutional laws to other more particular laws and regulations, were invoked in order to come up with a comprehensive strategy to fight this pandemic. And this provided a very important reference point to the history of epidemiology in Mexico and in the world. So 11 years ago, we had this very first reference point, and now we are in our current situation. This is another reference point for the history of epidemiology. Let's begin with the daily technical report. As you can see, the number and also the proportion of confirmed cases during the past 14 days worldwide continues to decrease. The current number is 44%, which means that the pandemic, at least during the last few weeks, has been decreasing in terms of its activity, specifically in the European region. However, we can see how the Americas has surpassed the European continent, although the difference between the two of them is not very sharp yet. And this is maybe due to the fact that Europe hasn't had an exponential decrease either, and the Americas haven't had an exponential increase. So the difference, even though we surpassed the European region a few days ago, we haven't seen a great widening of the gap that divides both of us. In this next slide, we have integrated different numbers that have to do with our current situation, and we are emphasizing the number of active cases, meaning the ones that have exhibited symptoms during the past 14 days. To this day, the cumulative confirmed cases are 11,633, but only one-third are active cases, meaning they have displayed symptoms during the past 14 days. And this number is 4,127 confirmed active cases. Also, we have a cumulative suspect cases of number of 7,588. We're currently under study and we are waiting for the results to come out. We've had in total 39,664 negative cases who have tested negative for COVID, even though being suspect cases in the beginning. And unfortunately, we've had 1,069 fatalities so far. Next slide. We can see you've been requesting this map different occasions, although all of this information can be found directly in real time, the updated information at the official website of coronavirus.gov.mx. So as you can see, here we are showing the cumulative confirmed cases is 11,633, and here we have a color scale in which we can observe which states have the highest number of cases and the highest concentration of the disease. The same data can be presented also in the form of a bar graph, and here we can observe the cumulative burden, meaning the total number of confirmed cases since the pandemic started in Mexico, and what is their distribution per state nationally. Next slide, we can take a look at the active pandemic in our country, meaning the cases that had started exhibiting symptoms for the past 14 days. So far, we have a total of 4,127 confirmed active cases, and we have a different color scale that shows the highest and the lowest concentrations that are found in our country. So here we can see which states have the highest number of active cases. The same information can be presented in the form of a bar graph, and we can have the overall total numbers and their distribution per state. Remember, we're talking about the active pandemic. Slide. This is the incidence rate. We are focusing here on the incidence rate for the past 14 days, meaning the active case incidence rate. Remember, the incidence rate is calculated on the basis of 100,000 inhabitants, and this is really a good instrument that allows us to make a fair comparison between states because it takes into account each state's population. Also, since this map is a representation of the active cases, it allows us to visualize in a fast manner which states are having a higher and a more recent concentration of cases. And what we can notice is that this increase in the number of active cases continues to be present in states that have been states with a high number of cases since the beginning of the pandemic. We're talking about Baja California, Quintana Roo, Sinaloa, Guadalajara, and the Mexico Valley area. Here we can have same information presented in the form of a bar graph, and we have an average of the incidence rate, which to this day is 3.22 per 100. So 3.22 active cases per 100,000 inhabitants on average in Mexico. Here we have the cumulative active cases and their distribution presented taking the date of when the symptoms started as reference. So we've had an upward trend, and we continue to see an increase, and all of these cases are of course accumulating, meaning that all of these cases that appear before are concentrating on the next bar, right? And the one that concentrates all of those cases is basically yesterday, which is April the 22nd. Which is the last day taken into account in this part. Here we have the data organized by the date of death regarding all those people who unfortunately have lost their lives. We have in blue, dark blue, the confirmed fatalities, and the suspect fatalities are on yellow. The suspect fatalities, meaning those fatalities who haven't been confirmed to be COVID-19 caused. But we are still waiting for the test results in order to be able to integrate them into the COVID fatalities number or leave them out if they were caused by some other reason. So as you can see, we don't have yellow bars or yellow segments in earlier bars because as time moves forward, we end up confirming all of these deaths, whether they are positive or negative for COVID-19. Here we have this same information presented per state, and here we can see which states have a higher number of fatalities. Here we have an pandemic curve distribution. The first curve is the suspect case cumulative curve, meaning all of those cases that at some point were cataloged as suspect cases because they exhibited COVID-19 related symptoms and they were admitted in a study protocol, and so they entered this statistic. That is why this curve is the most is the one with the highest numbers and the one that is more pronounced. The second curve, we have the other three curves. We have hospitalized patients distributed per their clinical state. So we have stable, severe condition, and critical condition. So for example, for the severe condition, hospitalized patients curve, meaning these patients exhibit some warning signs, some warning symptoms, and they remain to be hospitalized. To this day, we are talking about 2,800 or so hospitalized cases that are in severe condition. And the third curve is the critical state hospitalized patients. And we've seen a stable trend, the accumulation of these cases. Here we have the distribution per date of the start of the symptoms, and this is a good way of analyzing how the pandemic curve has been developing in Mexico. The red bars are those cases who have been confirmed, and we can see what is the trend, what is the tendency regarding this, the fluctuation of this data. But we also have the confirmed cases that are represented in yellow, and this means that the tendency can show some variation in the next few days, because a lot of these cases are still awaiting for the results. So of course we need to continue working in order to ensure that everyone is complying with the safe distance measures and the massive mitigation measures in order to prevent this pandemic from reaching an explosive speed in the future, which is precisely what we want to avoid. That would be my information for today. Thank you very much, Dr. María Elena Alvarez-Bulla. You have the floor now. Thank you very much, Dr. Hugo López-Gatell. I am very happy to be here. Good evening, everyone. In Mexico, there are many scientific and technological resources and capabilities, but a lot of these resources are unarticulated, and this becomes evident or becomes even more challenged in the face of a pandemic like the one we're dealing with. However, we have been articulating these resources through a number of programs and projects like the ones I'm showing on screen, the National Project for the Study of Incidents, and we've developed all of these projects because the evidence has shown the necessity of studying this phenomenon. And all of these are especially talking about January, the beginnings of January, when we found out about the existence of this pandemic worldwide, and we started developing a number of strategies and protocols and projects and studies that would allow us to be better prepared for facing this pandemic when it arrived in Mexico. So we gathered a big team of mathematicians, data scientists, and other experts come from different institutes, universities, and entities, and they started doing work related to this common goal. We also started exploring a number of clinical trials and a number of callings. Today I'm going to be talking about specifically about the national medical devices, because the President Andrés Manuel López Obrador asked the CONACYT to be in charge of coordinating the strategy for building and developing ventilators in due time, so we can use them to fight this pandemic in the country. These are the characteristics of the neoliberal science that we are dealing with and that put our country in a very difficult position amidst the current crisis. So the characteristics are we have a technological dependency, we have very limited articulation capacities, we have very low innovation efficiency, we have millionaire transferences into the private sector. We have the basic science that is in a state of abandonment nationally, and there's been very little output from the private sector that in a way that contributes to the national landscape. So the challenge we are faced with, and the petition that was delivered to us by the president, was to have 700 equipments ready for May the 15th, and they had to be invasive, of technology that is 100% Mexican, competitive regarding their price, and high quality, and meeting all the biomedical standards. Right? These equipment, as the Deputy Secretary has insisted on none, the priority is to prevent, right? So, first of all, we want to remind everyone that the most important thing we can do as a society is to prevent these older people and these vulnerable patients to reach a state in which they would need a ventilator. But because this will be a real necessity, and it is a real necessity, then we had this project of providing these 700 ventilators that had to be invasive, economical, like competitive in terms of price, 100% developed with technology that is an innovation that is 100% Mexican, as I said, and they had to meet all the highest quality and biomedical standards available. So there's 4 kinds of ventilators that we are referring to. The first of which is a kind of ventilator that uses the technology of the AMBU bags and incorporates them into its inner workings. But this poses a challenge because these kind of ventilators hadn't been manufactured for commercial purposes yet, even though in Spain, as far as we know, there are 2 ventilators of this kind that have been used and have had great success, but they are not so explored in the rest of the world. The second kind of ventilator is a ventilator that has a rigid chamber inside, and we call it a piston ventilator, a valve ventilator. Well, one of them is a piston ventilator, the third one is the valve ventilator, and finally we have the turbine ventilator. So these are the 4 kinds of ventilators. And as you know, they're all aimed at helping a patient with respiratory insufficiency to continue breathing. So CONACYT, in close collaboration with the Ministry of Health and through an agreement that is being signed by INSABI as well, which is the National Institute for Health and Well-being, and taking into account and with the participation of all of these institutions and brands that you can see in this slide, we explore different options for investing and for partnering up with some entities, and we will be explaining how the process of articulating this program happened in order so we could develop these ventilators and face this pandemic. This is an emergent innovation ecosystem that requires and was a product of a close collaboration between the CONACYT and the Ministry of Health. This is a project created by MIT but developed by CDESI, and there was a number of challenges that we had to face because the principles that were provided by MIT were very generic and in collaboration with other centers, but basically coming in.
We've also been working with the UNAM on this with a veterinarian surgeon. This model is still restricted in terms of its use. Soon we will have commercial units, which we have seen in Spain already with these same parts. Some tests have been done on these, for example, with the iron lung. But we want to be very sure that they're fulfilling our requirements and also hitting all the certifications that are necessary. So we are waiting for that. We hope in the next couple of hours that we will have some information on that. We're also waiting for the certification from the COFEPRIS factory. But this is looking very positive. Now, Grupo Safran has also been working on this. They're a French aerospace engineering company. So they're going to be working on putting these together and following all the engineering plans that are being confirmed at the moment. And CONACYT, of course, is following up on all of this and doing some of the final tests and also certifications on this. COFEPRIS has taken a look at where these items, where these machines are going to be built, because we need a very high standard of manufacturing. The company MABE is also going to be working on this, not for profit, of course. They are going to help us manufacture the electronic cards that CONACYT has designed. Now there's also a group of automotive companies in Querétaro who will also be building and putting together some of the parts of this for this novel ventilator that is coming out. We're also going to have some further collaboration for a second model. For this model, we knew that there was a risk for there to be a sort of a lag. So we also are going to have another prototype that is going to be created. We also took a look at how we could work with the company without profits. They're not looking for profits here. This company, Vidatech, does have experience, and so they are going to be collaborating on ensuring quality for the biomedical safety and security of this equipment. Here you can see another piece of equipment that we have been working on, that we've been reviewing and taking a look at all the engineering that is involved here. This is a Mexican piece of equipment. It's by Modelo Gatsi, which means breath in the language Otomi. Now, this is going to be great because it has such a high level of performance. This is already used in intensive care and fulfills the standards that are required for that. This company, Zodiac, is going to be working on this, and they're going to be working not for profit. DDTech is another company here that also works on biomedical safety. They are going to be working not just in installing them, but they're also going to be working with our College of Biomedical Engineers. And we want to say thank you so much. You've been so generous in giving us your feedback on the different prototypes. Now, this coordination isn't just to install this equipment where the Ministry of Health tells us to, but we also want the collaboration for them to be teaching doctors and nurses how to use the equipment effectively. Now, this equipment has been approved. It's been approved for use with iron lungs. And we also have the certification from COFEPRIS. We have a little check mark there. You can see that the prototype, yes, it's been tested on human beings, it's been tested on live organisms. Now, the last piece of equipment, I'm not going to spend too much time telling you about this, but we are supposed to have 200 pieces of that last piece of equipment that I showed you for May 15th. And once we have our first prototypes produced, then we will be able to start manufacturing these up to 1,000 additional pieces of equipment when that's required. For the cost, I'm going to put a little table comparing costs, but you will be able to see with these innovative movements, these innovative equipment that is coming out, we are going to have this equipment available at a price that is much lower than what you would get in the commercial market. This is the comparative graph. Here you see the dollars. Here are the two developments that CONACYT has been following up on and certifying. Technically, we're in the last phases here. COFEPRIS and Dr. Novello, and also the staff working with them, specialists who know about this type of equipment, have been reviewing it and updating it. And that has just been so helpful right now to be facing the pandemic. As you can see, there are references for how much other equipment costs. We haven't put their names there. But Mexico did had to buy some equipment, and we just want to make sure that we can start manufacturing that nationally. On the next slide, I'm going to show you that besides these two developments, thanks to the work that has been done by the Ministry of Health, by Foreign Affairs, by CEP, with civil protection, we have been appealing for other developments, for people to help us with other developments. We have 10 from Ambu Bag that we have reviewed and that do fulfill specifications. We have 2 for turbines, 4 for controlling external sources of gas, and 5 for the piston type of ventilators. We hope to be getting these in the first or second weeks of May. Now, up to date, none of these hit all the requirements and all the specifications that we need them to in terms of assembly, innovation, certification, because the thing is that the places that they're manufactured also have to be certified. So we had some industrial production going on there at these manufacturing plants. But thanks to the fact that these companies have made their factories available for this, we're seeing how we can convert those factories to making this type of equipment, but those factories also need to be certified. So you can see that we have all of these on our radar so that we can have an innovative ecosystem that will help us deal with this pandemic. Now, there's an email there for anyone who's watching. If you have some type of equipment that might fulfill these specifications, if you could please get in touch with us. There are some restrictions, there are guidelines which are necessary to be able to produce equipment that are along the guidelines of COFEPRIS. But of course, we want to be open to the possibility of incorporating other types of equipment and also knowing what is the panorama of our whole ecosystem for manufacturing ventilators nationally. So we would like to identify all options for moving forward with this. We want to develop this industry nationally in assembling ventilators. Our goals. Now, basically, we have these covered, and that's producing invasive ventilators in Mexico without profit. This is not for profit. Now, we would like to complement the ones that we have already acquired, but we do need to accelerate this project so that for the 1st and 2nd of May, we have quality engineering that fulfills the characteristics that we need. We have research centers, we have biomedical security standards, and we want to continue with this technological sovereignty under this new area of manufacturing. I'd like to talk to you about another point here that is also related to the health emergency and that people have been asking the president about. This has to do with investment in science and technology in Mexico and what proportion of this money comes from industry. First of all, I'd like to remind you, as a background piece of information, there is a bit of a paradox here. Now, we had increased science and technology funds in the last 6-year presidential term. But even with that extra spending, Mexico went down 16 spaces in terms of innovation efficiency. So that's the paradox that we were facing. It was more than 35 billion pesos that had been in CONACYT and had been transferred to private companies. But then why are we still in this position of weakness in terms of innovation and quick responses with technology to the pandemic? So what I put here for you is the percentage of the GDP, which from different countries, to use it kind of as a reference and make a comment on this. I want to talk to you about how these other countries have confronted this pandemic. So as scientists, we have some things very clear. Scientific development and technological development are of the utmost importance for a country's development. You can see Korea has a very high percentage that they're giving to science and technology. And you can see that this is coming from businesses. You see the green. This is what is being given to science and technology, money, funds given by companies to science technology, except for in Mexico. Less than 18%, around 18% is what has been contributed to from private companies to science and technology development. So with relation to the GDP in Mexico, it's very low. This is a challenge. This is an important challenge for Mexico. But I would also like to make a comment to you. There are countries that have a high percentage of funds that are uh, earmarked for science and technology. And then other countries, we can see they also have a very high percentage, higher, much higher than Mexico. For example, Italy. But this still shows us that spending on science and technology is not enough to solve a problem that is as serious as the one that we are facing right now. We need public policies that make science and technology a serious commitment along with taking care of the environment. So, what we are doing right now with the leadership in Mexico, with our president, AMLO, Andres Manuel Lopez Obrador, these resources, these scientific and technological resources, are channeled into universal benefit for our country, for everyone, benefit for everyone in our country. This is something that we need for the social well-being and for taking care of the environment. Now, many scientists in the world have spoken up, including scientists in Holland, and they are inviting us to rethink the whole world, the neoliberal system that we're living under. I'm convinced, just like many people are, that this is a symptom of the systemic neoliberal viewpoint that has not included science enough. We can see here, like the United States, even with their excellent scientific system and money that is earmarked towards science, that still a lot of people are dying there. So we can't just think about science and technology as something that solves problems. We need them to prevent problems. And this has a lot to do with environmental degradation and disorganization on a socio-ecological level. And that's what Dr. Lopez Gattel has been, he reminded us yesterday about another pandemic. But then he also reminded us of something that happened less than 11 years ago and has been threatening humanity. And from a scientific viewpoint, we do need to rethink the world order and we need to prevent for the future, for the social good, the environmental good, and to prevent these types of health problems. This is what I want to share with you. Now, the page is right there, the CONACYT page. You can take a look at that. Thank you, doctor. Thank you for that clear and wide-ranging explanation. Good evening, everyone. Doctors, I'd like to ask you, doctor, of the 700 ventilators, are there two models? One that has been made with collaboration with private companies and one that has been with public health institution? Is it 700 and 500, or is there, which research center is making these, and when are those going to be in the hospital? When can you say we've got them? And Dr. Lopez Gattel, now we have some testimonials from one of the EAMS hospitals, EAMS number 30. Now, a nurse there was saying, yes, we have gotten our consumables from China. We have gotten our equipment from China, but then they run out. We need constant supplies. The demand from COVID patients, it's present in every single hospital. That's a reality. And it's terrible to say, but patients arrive and we have to make a space for them. I mean, what are we going to do? Not make a space? But since the hospitals are not prepared and since the nurses don't have their personal protective equipment, what are they going to do? What are they going to do? Thank you. Yes, thank you, Laura. Thank you for your questions. Now, the first development is 100% CONACYT designed. We did work with some other research groups, and this is for assembling and for getting the parts and putting them together, and those are going to be put together at public research institutions. But for assembly and for acquiring some of these parts, or for assembling the electronic cards that are going to be in there, we're going to be working with other companies who are participating not for profit in a not for profit capacity. Now, the second development is 100% Mexican. We bought, well, we thankfully, luckily, have stumbled upon this very solid collaboration. And with those public research institutions, they have been so generous in sharing information and also in lending all of that information to us during this time. They could be right now, at these times protecting their information, but they're not. They're sharing it. So it wasn't, it was not easy to find a company that was willing to open up its designs and to say, you know what, yeah, we'll give you our designs, and then for the public research institutions to say, okay, let's check them out. So this is a collaboration that again is not for profit. And it's not just about sharing that design with the people of Mexico and with them and with all of Mexico to confront this, but it's also to help us to review everything that has to do with biomedical safety and security, including the assembling part. Now, this equipment is going to be finished on May 15th, and we're preparing a command center where we're going to be dealing with all the logistics to be able to install and train the doctors who are going to be using this ASAP. And we hope that that assembly process goes well. Up to today, it has been a very rigorous investigation process. Yes, the idea is that, yes, they will be completely assembled by May 15th. And then a few days after that, they'll be installed in the hospitals according to the Ministry of Health's directives. That's our goal. And we're going to do that. We're going to achieve that. Now, about this matter of hospital saturations, well, yes, we are in this phase of rapid ascension in the number of cases, and we've had more and more and more and more cases. We've had more people who need hospitalization, and we've had more people who are critically ill. And so we're getting to the peak of this pandemic. This is the first pandemic cycle, and it's May. The second week of May is when it's all coming. Now, and that comment really means a lot to me because it helps me to visualize that hospitals are still, they're still not identifying that they don't have to resolve everything themselves. We have seen that. We understand that. We need coordination and support. For example, IMSS, the National Institute of Social Security, that's a reference. It's a mechanism for our health system to release their excess demand, even when we're not in a pandemic situation, and send them to other hospitals in the case that they are oversaturated. Now, we are going to take a firm position in this matter and get information to all hospitals and all institutions so that they can support each other and channel patients from one to the other. Thank you. Mr. Randay, yes, you had raised your hand. Thank you. That's very nice of you. I'd like to ask you the WHO invited countries, everyone, all the countries to make a concrete plan for how they're going to deal with the pandemic in their hospitals. How many hospitals have you retrofitted? You said 6, maybe 3 weeks ago. So today, how many hospitals have been retrofitted? How many are left? How many do you still need to retrofit? Are they ready? And what state are they in? Thank you. Now, what Dr. Reyes said a few weeks ago, he was referring only to the coordinations for EAMS hospitals, which is, a small number of many. So 6, I guess, yeah, yep, those 6 that had been retrofitted for COVID, we completely evacuated them. For example, the respiratory disease hospital, we completely emptied it, and we, as I said, retrofitted those for COVID. Now, last Sunday, or when Reyes Terán was here with us, he announced this additional part of the reconversion, the retrofitting, and he was saying that the goal for that, just for federal hospitals and national hospitals, that was going to be 870 beds. We're just talking just in that one case there. Now for there's EAMS, there's Eastay, we have Pemex Medical Services, we have the Navy Medical Services, State Health Services. We saw yesterday that Claudia Sheinbaum was talking about a temporary hospital that was going to be dedicated just to COVID-19, and that was from the private sector. And we know that they did sign an agreement with the private sector so that we would be able to send people to private hospitals who have COVID. This is a massive operation. We also have a specific answer from the states, from each state. For example, Governor Cotle Garcia of Veracruz was showing us the advances that they had made over there. Now he had a temporary COVID hospital in Veracruz. So that has occurred, that has happened in a number of states, like in Baja California as well. They're retrofitting and creating temporary hospitals for COVID patients. In Ensenada, in Tijuana, they're going to have temporary COVID-19 hospitals. Up to today, we have identified about 700, a little bit more than 700 hospitals that are COVID hospitals. That's the generic term. They have different abilities, they have different capacities, and they have different numbers of beds. For example, the temporary unit COVID-19 hospital that was put up was going to be dealing just with secondary instance patients. It wasn't going to be dealing with critically ill patients. They were going to be dealing with phase 2 of recovery. So Dr. Valdez, who is the doctor in charge of that hospital, was saying that in order to unload patients or free up beds from other hospitals, he would be receiving patients at his secondary phase, his phase 2 recovery hospital. So we are planning all this. We did make that goal at the beginning. We said that this is the most challenging scenario, and we're coming upon the hardest part. 15,000 people who are critically ill and who need intensive care. Now, with the second model, with the second cycle that we presented a week ago on Thursday, we saw that our expectations for how many patients were going to be there was reduced, and that's very good. But that doesn't mean that we relaxed measures. It just means that we had a very high expectation, and it turned out to be a bit lower. So now we're working on getting ventilators from the United States, from China. We're working on developing ventilators nationally. So we're on it. Yes, I'm going to be more specific about that a little bit later. I just have that general piece of information that's 711. I had announced before that we were going to have that published in the official Gazette of the Federation. We also have that platform that we had been working on. It was in a pilot program for 10 days before but now it is obligatory. Every institution has to inform about how many beds they have available daily and how many beds are filled with COVID patients. And this is going to help us identify where is there a bed that's available so that hospitals are not going to be oversaturated, or hospitals that are on the point of collapse aren't going to be oversaturated. And this is obligatory. So Tuesday, Wednesday, we're still in the process of having all our states informing daily. Almost all of them are doing it, but not everyone daily, but we're working on that, and they have to do that by 8 a.m. Oh, sorry, we don't have time. Sorry, 7:59. We'll finish up tomorrow, okay? Thank you so much, doctor, for joining us. Thank you, Dr. Alomia.